Cello, Mrs. Fibromyalgia Frenzy here, going on an adventure only fibromyalgia frenzy people can go on. Glad to be here with you, and thanks for viewing this video. This is Series 1, Video 3. This is going to discuss the signs and symptoms of fibromyalgia, and why me? Why not you? Okay, glad to be here with you as I stated, so let's get to ticking and keep on kicking. Last video we discussed what the fibromyalgia is. In this video I'm going to give you information on signs and symptoms. You may ask, why me? Well, why not me? We just happen to be one of the millions affected. I will discuss the more common symptoms. I've suffered with fibromyalgia most of my life, not realizing it until a car accident brought it onto the surface. I didn't realize why I had so much pain and suffering throughout my body, especially the escalating and excruciating pains with my periods and heavy blood flow. I used to endure, but once I was diagnosed in 2003 by an excellent doctor, she sent me to a specialist after her testings, and he tested me too. He was an excellent rheumatologist, and that's the reason why I say that is you have to have those excellent doctors in order to diagnose your symptoms. He helped me through that diagnosis and treatment. I could not tell you which symptoms I find the hardest to deal with. Constant pain, tiredness, and mucho are the symptoms that followed the diagnosis, or the constant feeling that I had to explain myself or justify my condition to others. It was a process of elimination, various tests and scans with no conclusions, but I explained to my doctor some of the symptoms I was going through. If you are suffering from fibromyalgia like me, your diagnosis may be complicated. What does fibro feel like? Many say it feels like the flu, muscle aches, headaches, pain in the body, and then multiply that by 10 times. That'll give you some kind of ideas. But I say, to me, it feels like someone has poured gasoline on me and lit it. Sometimes my hubby says I feel hot and look red. I sweat and I feel warmer than normal. Okay, I actually feel heat rising from my neck area. Symptoms may be intermittent or constantly present. The variable nature of fibromyalgia makes it a difficult condition to diagnose. Many fibro patients report that they have at least several, if not all, of these symptoms at one time or another, plus a few that are not listed in the books or online. Now you will see me, like I said, reading notes, because with fibromyalgia, you tend to lose your train of thoughts, forget where you're going. So therefore, if I seem to stammer over my words a little bit, it's because I got to keep reading my notes and kind of keep my thoughts flowing so that you'll understand where I'm going with this. Now let me discuss the major symptoms. I'm adding my extra symptoms that I did not see online or in a lot of publications. I have restless leg syndrome, paresthesia, pins and needles. If you feel those pins and needles in the hands and feet, I have tendinitis, ringing in the ears. Now pain. Pain is the single most obvious sign of fibromyalgia. Is pain, it can happen all over the body and will come and go randomly. Many experience pain that is related to weather changes. You feel like a weather vane. I know I do. Cold or hot, real hot weather changes, fronts and impending storms. You already feel pain before weather is announced. My husband calls me the weather vane, and he's the weatherman because he can look at the sky and tell. He said, how you feeling? I'll say, yeah, I feel the rain coming. He said, you're right. So together we can predict the weather. Thinking about starting a weather channel. Okay. Let's go ahead on with this. You can feel pain before weather is announced. Cold and wet weather causes flare-ups. You can also experience pain that is on for months at a time. Now, extreme fatigue. Quite common with fibro, few find themselves able to get a satisfactory night's sleep. Exhaustion is distressing for many people beyond simple tiredness. Happens frequently, and though you may be sleeping at night, the daytime sleepiness could very well be a symptom. Fatigue is extremely common with fibro patients. The vast majority of adults living with the illness typically report fatigue or exhaustion as their biggest symptoms. You routinely have challenges resting at night as you previously could, or bouts with pain and stiffness that can keep you from enjoying the night resting period. If you do not get REM sleep, then you are not resting. Okay. This resulting it can be causing depression. Fibro can cause you to feel tired and just plain worn out, almost as if you feel at the onset of the flu. Now I'm going to discuss tender points. Can you see this? It is very important part of the diagnosis of fibromyalgia. After ruling out other medical problems you may have had, physician will want to consider whether or not you have tender points. In fact, tender points is one of the major tests that help doctors to diagnose fibro. This chart shows your tender points, the front and the back. Our specific area of the body as shown on these pictures. They are very painful when gently prodded or probed. I remember my doctor doing it, and boy, did I get angry about it. But I knew she had to do it. Now, they are very painful when gently prodded. Tender points aren't the same as trigger points, which are lumpy or ropey muscular knots or inflammations. With tender points, we feel pain, but the doctor can't feel any apparent abnormalities or detect the presence of inflammation or disease. They see the reaction of the patient wincing or cringing. There are 18 tender points, which was developed by American College of Rheumatology, primarily located on the upper torso. A few can be on other parts of the body, such as in the knees. According to some doctors, to obtain an official diagnosis of fibromyalgia, you should feel pain in 11 or more of them. But that's not great, because sometimes you can go into your doctor and you feel great, and sometimes they can touch those points and nothing happens. Then other days you can just jump off the scale. Now, some days may be worse than others, and you may only feel pain in 9 or 10 of them. Thus, other doctors think that it's more accurate for even fewer of these tender points. But if you meet other criteria, you may still have fibromyalgia. This tenderness can also make it challenging to do things, such as shower or even wear your clothing, because when I have pain and I put on clothing and it's tight, it bothers me. Okay, and sometimes you have people when they want to touch you or hug you, those points can just make you not want to, but you bear it because you know people love you and you have to accept that. Depression. With fibro, you are at risk for depression. It's no surprise that it happens due to the chronic pain and fatigue associated with this condition. It can be challenging to combat fibro-related depressions. Now, I'm just going to kind of hold this up so you can see the list. Now, I've discussed flu-like pain that can be severe, constant feeling exhausted, specific tender points that hurt, for overall body aches. Now we're going to talk about depression, feelings of hopelessness. Now with fibromyalgia, like I said, you're at risk, and it can be challenging to combat fibro-related depression, as it runs concurrently with how severe the pain and depression as other symptoms may be during a particular time. Having lots of pain that doesn't seem to easily decrease, it can certainly be understandable why we get saddened so often. You have severely low mood states, poor self-worth, appetite and sleep disturbances, loss of enjoyment in activities that you used to find pleasure in, muscle stiffness and spasms. Especially in the morning, when I get up my joints crack and pop, and I find problems moving around. But I have to move around regardless of the pain, because the more you sit, the more you do not want to move. And you're going to be in pain anyway, so get up and move. All right, in my next video, I'm going to discuss the good ways of combating stiffness and pain and all that. So that's the next video. Especially in the morning, severe muscle stiffness and aches is at its worst then. Stiffness and pain in joints are very common with fibromyalgia. It can definitely worsen if you are sitting, standing for extended periods of time, or when you first get up in the morning. If you experience stiffness in the body, often without ever physically exerting yourself, then you may have fibro. Muscle spasm seems to be one of the more irritating symptoms of the condition, as you experience not only pain, but sudden and intense spasm throughout your muscle. The next one I'm going to discuss is insomnia or other sleep disorders. Extremely common for fibro-frenzied people. Pain often surges at night, causing insomnia and other sleep disturbances. Lack of sleep makes you feel worse, which in turn makes it harder for you to sleep the next night. When you do sleep, it is a light sleep that can be easily ended by the slightest pain sensation. After so many days in a row not getting REM sleep, you feel life in slow motion. Lack of sleep only worsens the symptoms of pain and joint achiness. And this pain can prevent you from falling asleep initially. Now, this is the next one that I feel a lot of. Mental malaise, confusion, often referred to as fibro fog. Everyone with fibromyalgia gets this. I've talked to many people, and everyone talk about the worst part is forgetting things or forgetting what you're doing. Walking out the house, forgetting your keys. I've done that before. Mental confusion and forgetfulness, particularly attention and concentration difficulties. Inattentiveness, hard time paying attention, not an effective listener, like slogging through a deep mental mire. Memory loss and brain fog often accompany pain and other symptoms for those suffering from fibromyalgia. Not surprising, since you typically experience a great loss of sleep with this condition that can affect your memory, because you need to refresh your brain. And if you're not getting your REM sleep, guess what? You're not refreshing yourself. Now, you can often feel like you are in a fog as you go about your day-to-day activities. Confusion. I get a lot of that while I'm even talking to you now, because you'll see me stammering, but that's okay. This will give you an idea of what you have to look forward to. But don't worry, there's ways to combat that too. It temporarily happens, sometimes hard to solve problems when unable to pay attention. Stress and pain can trigger or worsen it. This is one I hate, the next one. Irritable bowel syndrome, IBS. A colonic condition that causes alternation between constipation and diarrhea. Another name for it is spastic colon. And usually when you have IBS, you switch between the two extremes. There is a connection to IBS and fibro, as the pain and stiffness is common in both. If you have one, typically you have both. This can cause pain in the abdomen area, as well as painful constipation. It's a troublesome symptom, as it makes it hard for you to have regular bowel movements. There's also ways to kind of lighten and combat this. I will explain that in the next video. Okay, interstitial cystitis. Let me say that again. Interstitial cystitis. I had that word together before I got on this. Interstitial cystitis. There we go. IC. Also called painful bladder syndrome. You gotta laugh at yourself. Is a chronic condition causing bladder pain upon urination, also, and sometimes pelvic pain. The pain ranges from mild discomfort to severe. One feels an urgency to urinate constantly, even after you just went. Many feel like they have a bladder infection, but no bacteria can be found in the urine that is tested. The next one, Arthritis. Yes, Arthur and all his friends will move on in your body. Okay, let's discuss that. Joint inflammation is a worsening existing problem of fibro. I have osteoarthritis, which is common. Progressive deterioration of the cartilage and joints of the body causes pain and inflammation of the joint. The next one, headaches. Do you have those migraine headaches? Maybe another sign of fibromyalgia. The underlying problem could be that whatever is in the body that controls pain has gone awry. Or it could be that the body is oversensitive to pain, or maybe both. These migraines are extremely severe and is often accompanied by nausea and vomiting for most people. Now, I've had migraine, but I haven't did the vomiting. I've had nausea. Thank God. Pain is excruciating and can be blinding. Some get experience called auras before the pain of migraines begin, ranging from seeing strange lights, which I do sometimes, little speckled lights, to smelling something that isn't there, to other auras. You can have sensitivity to lights and sound. Oftentimes, I would just lie down in a dark room and turn off the lights and just wait it out. Don't move until it goes away. Then there are tension headaches, not necessarily caused by stress or tension like normal people. They stem from tightening of the muscles, often in the neck, and are very common, but with fibro, they can be chronic. All of them headaches that come from tension, forget it. Okay, the next one, tingling or numbness, and you can have both. Paresthesia, feeling like pins and needles in your hands and feet. I get that a lot. And the limbs or face going numb, hands falling asleep. Okay, the next one, heartburn, GERD. Yeah, you can have that too. I know it sounds horrible, but there is so much linked to this, and if you have all of them, you definitely have it. Okay, maybe GERD, gastroesophageal reflux disease. Food comes partway up the food tube, the esophagus, instead of going down where it belongs, known as acid reflux. The next one, temporal mandibular joint disorder, TMJ. Sometimes a lot of people go to the dentist about that. Now, pain in the jaw that joins with the upper and lower jaw. Muscles ache in that area, causing a sensation of the jaw to pop and feel as if it is going to lock up on you. Now, ladies, this one is a pet peeve, was years ago of mine, and I didn't realize why I had this. Premenstrual syndrome, PMS. Painful periods due to constant cramping, accompanied by heavy flows. Some women also advise that they experience pain during intercourse with their partners. This can lead to depression and anxiety. Now, the last one I am going to discuss is mitral valve prolapse. This by no means ends the list because others have suffered with other things. But let's discuss these major ones. This is the last one. Improper closure of the valve between the heart's upper and lower left chambers can cause palpitation or abnormal heartbeats, dizziness. One may even pass out from dizzy spells. Dyspnea, which is shortness of breath, especially after physical exertion, and also chest pains that come and go quickly and suddenly, and sometimes experiencing cough. You may think you're having a heart attack or stroke. And a lot of times I know the difference because I get those little sudden pains that just hit once and go. Okay, now, many signs and symptoms of fibro are similar to those caused by other joint and muscular or immune system disorders. So diagnosis is typically a long and frustrating process. When I was told by my physician that she had to test to rule out, that means ruling out other diseases, I had no idea what to make of it, what she was talking about, until I found out what I had to go through to confirm I had FMS. I had to go through a lot of tests and x-rays and scans and blood tests, etc. A long and tedious process, referrals to confirm diagnosis. I spoke with psychologists, Fibromyalgia is a physical health disease. Though anxiety is a primarily mental, it is associated with many undesirable physical symptoms too. Since these problems target your physical health, it is up to you to fight back, which I am doing vehemently. Don't be negative. Negativity only makes it worse. Being diagnosed with fibro is an example of letting the negative rule you. When the condition hits, it is easier to become focused on the symptoms, the side effects of the medications, and how your life is forever changed for the worse. It is easier to permit the repercussions of the condition to grow and transform from a medical condition into something that begins to consume many aspects of your physical, mental, and social health. It is easier to resign yourself to a painful life of fibro, but I will discuss this aspect in another video because I digress. Finding out if you have FMS, consider patterns among people already diagnosed with it. You can still have fibromyalgia if you don't fit neatly into one or more of these categories, but it is less likely. There are medical problems often confused with fibromyalgia, such as chronic fatigue syndrome, myofascial pain syndrome, arthritis, and thyroid disease. Fibromyalgia is the real deal, no matter what you have heard from other people who act like they know what they're talking about. Fibro isn't just in your head. Fibromyalgia pain travels throughout the whole body, so it's not just in your head. Do you have fibromyalgia? Only a knowing doctor can diagnose you with fibromyalgia and treat you. Even so, let's go through some pointers in my next video to see if there's a possibility to make it easier to speak with your physician about the subject, if and when you should be tested. So the next video will be about picking the right doctor, diagnosis, and treatment of fibromyalgia. So with that being said, I'm going to close this. So if you are still interested, please like, subscribe, and share. And do comment. I look forward to comments and questions. And when you subscribe, you will get notices on my next video release. But for now, keep on kicking. And I will see you later. Mrs. Fibro Frenzy, over and out. And I'm done with this mess.